What causes female infertility? Infertility is defined as when a woman tries to get pregnant for at least a year without success. Symptoms. The main symptom of infertility is the inability to get pregnant. A menstrual cycle that's too long, 35 days or more, or too short, less than 21 days. When to see a doctor. This depends on age. Up to 25 years. Most doctors recommend trying to get pregnant for at least a year before testing or treatment. If you're between 35 and 40 years, discuss your concerns with your doctor after 6 months of trying. If you're older than 40 years, your doctor might suggest testing or treatment right away. Your doctor might also want to begin testing or treatment right away if you or your partner has known fertility problems, or if you have a history of irregular or painful periods, pelvic inflammatory disease, repeated miscarriages, cancer treatment, or endometriosis. Causes. The following steps have to occur for pregnancy to happen. The steps in this process are: one of the two ovaries releases a mature egg. The egg is picked up by the fallopian tube. Sperm swim up the cervix through the uterus and into the fallopian tube to reach the egg for fertilization. The fertilized egg travels down the fallopian tube to the uterus. The fertilized egg implants to the inside of the uterus and grows. There are factors that can disrupt this process at any step. This includes ovulation disorders. Ovulating infrequently or not at all accounts for missed cases of infertility. Problems with the regulation of productive hormones by the hypothalamus or the pituitary gland, or problems in the ovary, can cause ovulation disorders. Polycystic ovary syndrome. Polycystic ovary syndrome causes hormone imbalance which affects ovulation. Polycystic ovary syndrome is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. It's the most common cause of female infertility. Hypothalamic dysfunction. Two hormones produced by the pituitary gland are responsible for stimulating ovulation each month: follicle-stimulating hormone and luteinizing hormone. Excess physical or emotional stress. A very high or low body weight, or a recent substantial weight gain or loss can disrupt production of these hormones and affected ovulation. Irregular or absent periods are the most common signs. Primary ovarian insufficiency, also called premature ovarian failure. This is usually caused by an autoimmune response or by a premature loss of eggs from your ovary, possibly as a result of genetics or chemotherapy. The ovary no longer produces eggs and it lowers estrogen production in women under 40 years. Too much prolactin. The pituitary gland can cause excess production of prolactin, which reduces estrogen production and can cause infertility. This can also be caused by medications you're taking for another condition. Damage to fallopian tubes, called tubal infertility. Damaged or blocked fallopian tubes keep sperm from getting to the egg or block the passage of the fertilized egg into the uterus. Causes of fallopian tube damage or blockage can include pelvic inflammatory disease, an infection of the uterus and fallopian tubes due to chlamydia, gonorrhea, or other sexually transmitted infections. Previous surgery in the abdomen or pelvis, including surgery for ectopic pregnancy in which a fertilized egg implants and develops somewhere other than the uterus, usually in a fallopian tube. Endometriosis. This occurs when tissue that typically grows in the uterus implants and grows in other places. This extra tissue growth and the surgical removal of it can cause scarring, which can block fallopian tubes and keep an egg and sperm from uniting. Endometriosis can also disrupt implantation of the fertilized egg. The condition also may affect fertility in less direct ways, such as damage to the sperm or egg. Uterine or cervical causes. Benign polyps or tumors are common in the uterus. Some can block fallopian tubes or interfere with implantation, affecting fertility. However, many women who have fibroids or polyps do become pregnant. Problems with the uterus present from birth, like unusually shaped uterus can cause problems becoming or remaining pregnant. Cervical stenosis, a narrowing of the cervix, can be caused by an inherited malfunction or damage to the cervix. Sometimes the cervix can't produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. Unexplained infertility. There are some cases where the cause of infertility is never found. A combination of several minor factors in both partners could cause unexplained fertility problems. Although it's frustrating to get no specific answer, this problem can correct itself with time. Risk factors. Certain factors may put you at higher risk of infertility. This includes age. The quality and quantity of a woman's eggs begin to decline with age. In the mid-30s, the rate of follicle loss speeds, resulting in fewer and poorer quality eggs. This makes conception more difficult and increases the risk of miscarriage. Smoking. Besides damaging your cervix and fallopian tubes, smoking increases your risk of miscarriage and pregnancy. It's also thought to age your ovaries and deplete your eggs prematurely. Weight. Being overweight or significantly underweight may affect ovulation. Getting to a healthy body mass index might increase the frequency of ovulation and likelihood of pregnancy. Sexual history. Sexually transmitted infections such as chlamydia and gonorrhea can damage the fallopian tubes. Alcohol. Excess alcohol consumption can reduce fertility. Diagnosis. Fertility tests might include ovulation testing. An at-home, over-the-counter ovulation prediction kit detects the surge in luteinizing hormone that occurs before ovulation. A blood test for progesterone, a hormone after ovulation, can also document that you're ovulating. Other hormone levels, such as prolactin, also might be checked. Hysterosalpingography. This procedure involves a X-ray contrast being injected into your uterus, and an X-ray is taken to check for problems inside the uterus. The test also shows whether the fluid passes out of the uterus and spills out of your fallopian tubes. If any problems are found, you will likely need further evaluation. Ovarian reserve testing. This testing helps determine the quality and quantity of eggs available for ovulation. Other hormone testing. Other hormone tests check levels of ovulatory hormones as well as thyroid and pituitary hormones that control reproductive processes. Imaging tests. A pelvic ultrasound looks for uterine or fallopian tubes diseases. At times a sonohysterogram, also called a saline infusion sonogram or a hysteroscopy, is used to see details inside the uterus that can't be seen on a regular ultrasound. Treatment. The treatment depends on the cause, your age, how long you've been infertile, and personal preferences. Treatment either attempts to restore fertility through medication or surgery, or help you get pregnant with sophisticated techniques. Medications to restore fertility. Medications that regulate or stimulate ovulation are known as fertility drugs. Fertility drugs are the main treatment for women who are infertile due to ovulation disorders. Fertility drugs generally work like natural hormones, follicle-stimulating hormone and luteinizing hormone, to trigger ovulation. They are also used in women who ovulate to try to stimulate a better egg or an extra egg or eggs. Fertility drugs include clomiphene citrate, gonadotropins, metformin, letrozole, bromocriptine. Surgery to restore fertility. Surgery treatments for fertility are rare these days due to the success of other treatments. They include laparoscopic or hysteroscopic surgery. This involves correcting problems with the uterine anatomy, removing endometrial polyps and some types of fibroids that mishap the uterine cavity, or removing pelvic or uterine adhesions. Tubal surgeries. If your fallopian tubes are blocked or filled with fluid, your doctor might recommend laparoscopic surgery to remove adhesions, dilate a tube or create a new tubal opening. This surgery is rare, as pregnancy rates are usually better with in vitro fertilization. For this surgery, removal of your tubes or blocking the tubes close to the uterus can improve your chance of pregnancy with IVF. Reproductive assistance. The most commonly used methods of reproductive assistance include intrauterine insemination. During IUI, millions of healthy sperms are placed inside the uterus around the time of ovulation. Assisted reproductive technology. This involves retrieving mature eggs, fertilizing them with sperm in addition to a lab, then transforming the embryos into the uterus after fertilization. IVF is the most effective assists reproductive technology. An IVF cycle takes several weeks and requires frequent blood tests and daily hormone injections.